Hello, Sean Willingham, the Medicare Man, here to give a shortened version of my original Medicare versus Medicare Advantage talk. As you might know, there are two different versions of Medicare, two different ways that you can get your Medicare benefits: the original Medicare program or Medicare Advantage. The first important thing to note is that with either version of Medicare, you will pay the same federal government premium and income adjustments. Okay, where they differ is in the coverage, access, and what insurance products you need to layer on top of either program. To start with original Medicare. With original, it comes separate. First, you have your Medicare Parts A and B as your primary payer for your hospital and medical bills. That's all you get under original Medicare for the federal government premium and income adjustments. Okay? It pays first a Medicare supplement, or sometimes referred to as Medigap. It comes in as secondary payer. It works as an appendage to original Medicare from the government. They work together like one plan. So, for example, you go to the doctor's office, Medicare pays 80% under Medicare Part B. Well, then the gap policy is just going to pay the remaining 20% seamlessly. Okay? But you got to pay extra for that gap insurance. Medicare Part D, prescription drug, also comes separate and extra under the original Medicare program. Now, I like to refer to the original Medicare program as the more option. Let me explain what that means. First, it's more choice. What I mean is choice in picking your own medical providers, doctors, hospitals. Because with the original Medicare program, you can go to any provider that takes Medicare Parts A and B anywhere in the U.S., no referrals. So it gives you more choice in picking your own providers. Secondly, I like to say it gives you more coverage. Because between the federal government, A and B, and the supplement insurance, you are left with the lowest out-of-pocket expenses for your hospital and medical bills. For example, go to the doctor, Medicare pays 80%. Under Medicare Part B, supplement pays 20%, you pay zero. Okay? So that's the more coverage. And lastly, it's the more premium option. What I mean by more premium is that you have to add extra supplement insurance and pay extra for that. Same thing with a prescription drug plan. You add it and pay extra separate for that. Now, with Medicare Advantage is where you get your Medicare benefits bundled from an insurance company. They put together your A hospital, your B medical, and your D prescription drug. They bundle it together. You get one plan from one insurance company. And the primary attraction, in my opinion, is that all you pay is the federal government premium with many plans, and you don't have to pay any extra premium for any extra insurance. Okay? Now, I refer to the Medicare Advantage option oftentimes as the less option. Okay? To start off with, it's less choice because with most Medicare Advantage plans, you have to use in-network doctors, and with many of them, you have to get referrals from your primary care to see specialists. So that's where the less choice comes in. A Medicare Advantage plan is less coverage because with a Medicare Advantage plan, when you go and have a service done, you're going to have an out-of-pocket expense, usually in the form of a copay. And so it would be less coverage than, say, you would have otherwise if you were on original Medicare with a supplement filling the gaps. So Medicare Advantage, less choice because of the network providers and referrals. Less coverage because you have out-of-pocket expense, usually in the form of copays for your doctor and hospital visits. But the final less under Medicare Advantage is less premium. Because you don't have to go out and buy extra insurance and pay higher premium for extra insurance. So that is my shortened version of the original Medicare versus Medicare Advantage. Original Medicare being the more option, People choose that option because they're willing to pay more for more coverage. Whereas Medicare Advantage is the less option, where people are gravitate towards that because they pay less premium and they are looking for a bargain. That does it for today. Please feel free to reach out to us. You can always find us at themedicareman.com. Thank you very much. Have a great day.